Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for parents and caregivers of 4-month-olds. This is a list of 10 tips to help you raise a happy and healthy 4-month-old. Tip number 1. The first thing to keep in mind is that you can't spoil your baby. Babies need to know at this age that they are in a safe environment, that their needs will be provided for. So there is no limit to the amount of talking to your baby, to the amount of holding your baby, and to the amount of care that you give your baby at this age. There's no way to spoil a baby at 4 months old. The more care you give your baby, the more confidence your baby will have that the world is a safe place and that their needs will be provided for. Point out
that not always will you be able to get your baby to stop crying, and sometimes your baby is just cranky.
If this is the case, so if you've done everything you can, if you've made sure that your baby is safe, clean, dry, and well fed, and your baby still doesn't cry, and your baby still keeps crying and won't stop, it may be, and you're feeling overwhelmed, then it's important to know that it's okay to put your baby down in your baby's crib and to take a break. Drink some coffee, drink some tea, call a friend. You're not always going to be able to get your baby to stop crying, and if you get to the point where you're starting to get aggravated, it's important to take a break and to relax, and then you'll be in a better state of mind to care for your child. Tip number 2 is establish routines. It's very important at this age to establish routines. What this means is that you have a scheduled time that your baby wakes up, a scheduled time for meals, and a scheduled time for naps, as well as a scheduled time for baths and a scheduled time for bedtime. Keep in mind that your baby will not always sleep through the night, and that's okay, and that you can always vary from this schedule. But a schedule is an important thing to establish for a 4-month-old. Tip number 3, playtime. Playtime is very important for your baby, and there are a lot of safe toys that your baby can be given to play with. Soft toys are especially fun to play with. Having an unbreakable mirror so that your baby can look at herself can cause endless fascination for your youngster. And it's also important to have tummy time for at least an hour a day when your baby is able to be on her tummy instead of on her back. This not only helps with her developed neck muscles, but prevents her from having a flattened head on the back of her head from being on her back too much. Tip number 4 is brain development. Your baby's brain is developing. There are things you can do to develop.
Talk to your baby all day. Of course, it's not going to be easy to talk like a baby to your baby, like goo goo goo, ga ga ga. And it's not even necessary to talk to your baby like that. It's actually important to talk to your baby using full sentences and to vary your vocabulary and your tones. Now we're going to the park. Look at the bird in the park, and look at the cat. So when you talk to your baby using full sentences and a large vocabulary, you're training your baby. Maybe your baby won't understand it all, but through repetition, your baby's vocabulary will expand, and she'll start to remember the things that you're teaching her. You should get into the habit of reading a book to your baby every day. Vary your talking to your baby with singing, and make sure to avoid any television until age 2. Again, television is a passive activity. Even though your baby's listening to a lot of language, it's still not an active way of learning, the way that it is when she's talking to you or playing games that are real in front of her instead of watching them on television. It's been proven that babies' brains develop much better when they're not exposed to television during the first 2 years of life. Tip number 5 is about nutrition. So, first of all, you should know that your baby will start to eat slightly less than she did during the first 4 months of life. If your baby was eating maybe 10 to 12 times a day, now it may decrease to 8 to 10 times per day. The way to know that your baby is growing appropriately is to expect 1 to 2 pounds per month, or
1/4 to 1/2 pound per week of weight gain. If your baby is being fed breast milk, and from birth to 4 months, breast milk is the ideal food and the only food that your baby needs, then it's important to add vitamin D drops. Ask your doctor for a prescription. If your baby is formula fed, then it's important to make sure the formula is iron-fortified. Aim for about 30 to 32 ounces of formula per day. At about 4 months, your baby will stop doing a tongue thrust reflex. This is a reflex where with anything put in your baby's mouth, she sticks her tongue out and spits it out. This reflex tends to go away at age 4 months, so it's time at that point to start introducing solid foods, although it's fine to continue just breast milk for 6 months only.
I mean only breast milk up until 6 months.
If you do start introducing foods, make sure that you start with baby cereal, and the recommended amount is 2 to 3 teaspoons per day. If you are introducing new foods, make sure to do them one at a time and to wait 4 days of your baby eating that new food before trying the next food. The reason for this is that if your baby has a bad reaction like diarrhea or rash, then you'll know exactly what caused it because you're separating the foods by 4 days. Tip number 6 is dental health. Dental health includes tips for teething. Your baby might start to teeth at 4 months. Teething is when the teeth start coming in. You'll notice that your baby has a lot of saliva coming out of his mouth, and maybe he's putting things in his mouth and chewing on them. Maybe he's fussy. He might even have an elevated temperature. It's never going to be over,
but it might be slightly elevated above 98.6. If your baby is teething and having discomfort, giving her a cold ring, a teething ring, has shown to be helpful. Also, to prevent cavities, it's important not to just, and if your baby's bottle fed, to prop the bottle in your baby's crib or just leave her alone in a chair with the bottle. It's important always to be holding the bottle and feeding your baby. This will ensure that your baby gets enough food and that your baby is not getting cavities from the bottle always in her mouth. It's not recommended that for the first 4 months of life and even the first 6 months that you give juice. But if you do want to introduce juice, make sure it's only 100% fruit juice. And make sure that it's no more than 4 ounces of 100% juice each day. Tip number 7, here are some safety tips. Make sure your baby is not exposed to secondhand smoke. If you or someone who takes care of your baby smokes, then try your best to stop smoking. If you can't stop, or the person who's caring for your baby can't stop, then it's preferable that they actually change their clothes before holding your baby, and only smoke outside. If you do smoke outside, though, the smoke is still on your hair and clothes. A bathrobe, or change your clothes and shower before holding your baby. Water safety is another important issue. When you bathe your baby, never leave her alone, even for a second, to avoid drowning. Make sure that all of the hot water in your house goes no higher than 120 degrees Fahrenheit. The last tip for safety is fall prevention. Your baby may start to be able to roll on her stomach. And so it's very important to always keep your hand on her when you're changing her on the changing table. Tip number 8 are some sleep tips. Make sure that you always put your baby back to sleep, so back on the bed. This will reduce the risk of sudden infant death syndrome, or SIDS. Make sure that there are no loose blankets that your baby can suffocate on. In your baby's crib, the slats should have a space no greater than 2.5 inches between each slat. And expect your baby to sleep a maximum of 5 to 6 hours. So don't be surprised if your baby's waking up after 5 or 6 hours. And if your baby is waking up, it's probably to feed, and this is a normal thing for her to do at this age.
Tip number 9 is to see your doctor. There is a scheduled 4-month check that's recommended. During this check, your doctor will be able to check your baby's height and weight, make sure that the baby's height and weight is growing appropriately on the growth curve, do a physical exam looking for any abnormalities, ask you about how your baby's developing, and examine your baby to make sure that your baby is meeting all of her milestones. And make sure that you're up to date with immunizations. By now, your baby should have already received the second Hep B dose, and it will be time to get the DTaP, polio, Hib, PCV, and rotavirus. Of course, ask your doctor about each one if you're concerned about the number of shots, but it's great to keep up to date with your baby's shots, and these are the appropriate shots and the safe shots to get at this age. Tip number 10 is to believe in yourself. Having a 4-month-old is a great experience. They're a lot of fun, and these tips are meant to help you raise a happy and healthy 4-month-old. I hope these tips have been helpful,